That sounds good. I'm excited to talk to this this panel of non-pharma related people. Although one has just ventured to join Boehringer, so I'll let them tell you a little bit about themselves. Jennifer, who is from Caesars, and Vicki, who is from MassMutual, and Karen, who is just joined Boehringer and has come over from doing customer experience with Gore. So I will let each of you, as you turn your camera on, because I think you can probably hear me, and then your mic on, you will be popping up on the screen automatically. There we go. There you go. Awesome. All right, that's awesome. And then everybody just post your questions in the Q&A, and Seth and I can monitor them as we go. Oh, we lost Vicki for a second. Hopefully she will come back up. So I will just start with introductions and let you guys take us through who you are, what you do, where you're working, since it is not known to us, brands that are known to us, but less known, not pharma. So go ahead, Jennifer, go ahead.
Sure. Jennifer Galle. I'm the Regional Vice President of Marketing for Caesars Entertainment over our casinos and resorts in the Eastern Division, so Pennsylvania, Maryland, and New Jersey. And so I oversee marketing strategy for those collection of casinos and resorts. And, this topic is obviously important to me because what we sell is kind of the experience, whether coming to one of our resorts for obviously gambling or entertainment or whatever that might be.
Cool. Yes. Very interesting experiences for sure. Vicki, how about you next?
Hi, I'm Vicki Whichard. I'm head of digital customer care at MassMutual and have a long history in healthcare, worked for the Blues, actually worked for Geisinger, integrated health systems. So have seen the whole experience from member to patient. And now I'm at MassMutual in life insurance. And you might ask, what's the experience there? Actually, I'm part of a new division where you can buy life insurance online, similar to Oscar for healthcare. So.
Okay, very cool. Yeah, we'll talk about that. That's great. Karen, how about you?
Yeah, thanks. I'm Karen Root, and I do have to share my disclaimer that my views and opinions are my own and don't represent either W.L. Gore and Associates, where I'm leaving, or Boehringer Ingelheim, where I'm going. And I know Seth had asked previously, well, what is W.L. Gore and Associates? And most people are familiar with Gore-Tex, but you probably encounter 30 to 40 products every day. We have a medical division, in industrial and communications or electronics division, and then fabrics. So just to give that level setting.
All right, cool. Well, that's great. So I think Vicki, you touched on it. There is customer experience in all of what you all do. I think you all, no matter how, you have to address your customer in certain ways. So I think it's fun for pharma to understand how non-pharma industry places are approaching the customer, and in what challenges you've experienced or what ways we could take some of what have been your successes. So I think maybe first start off with how you're approaching customer experience in each of your industries, and what do you think about when you think about customer experience? And I can start, Vicki, since you brought it up that, what is life insurance experience? And I think if you're talking about online, that's probably where you're starting to focus. How about you can start us off?
Sure. So customer experience in MassMutual, and I have to say, I've only been at MassMutual for 2 months. So relatively new to the role, but responsible for providing support for our financial advisors through digital channels. So they're our customer through chat, email, live phone conversations, and tickets. And so they're supporting our customers, and they are our customer as well. So just providing support in any channel when and where they want it. Some people always want to talk to someone and others want to do it digitally. So our whole plan is to make everything digital to make it easier for them. And we also have a division that sells directly to consumers. And of course, that customer experience is important there as they navigate through the screens to apply for life insurance.
Yeah, so you're doing it directly. So a person like just logging on to MassMutual and they can sign up. Yeah, which is, I think, makes it just easier than it probably ever has been. So that's great. I guess, Jennifer, how do you approach it from the casino world? I know we were talking a little bit about integrating that experience, and that's probably a bit of a challenge. So how do you approach customers?
Yeah, sure. I mean, from my perspective, thinking, from marketing strategy, customer experience is important because it's really, like at a high level, it's sort of the value that you create for the customer. And so I think about that because, in our resorts, and again, we have people that come to visit us and for a lot of different reasons, but mainly, right, gambling. So people can win or lose, and the experience and making sure it's a top-notch experience is really what's going to create value, that if a customer does lose, that they still feel like they want to come back. And so I think about it a lot, that it's an important piece of the puzzle, because if we don't sort of have that, then I'm spending more in order to drive, in incentives or other things or other channels of marketing. But, if you can get a customer experience right, and then you're creating that value without having to spend actual hard dollars into that. So
yeah, I'm just realizing that is a tough sell, is to say you lost, but you still had a great experience.
Exactly.
So, the challenge there, definitely. Yeah.
For sure.
Yeah, that's great. And Karen, I mean, I guess in both your areas, I mean, with Gore overall, how you were approaching customers in the multiple industries, I'm assuming, and what you're trying to achieve there.
Yeah, absolutely. So, fundamentally, you start with that basic framework that the experience needs to bring to life the expectations we set with our brand promise, right? That's the fundamental piece. So I approach it by developing out a signature experience that encompasses all of Gore and all of the multitude of divisions. And that also connects directly to employee experience, because it's holistic, right? The good employee experience begets a good customer experience, begets the business outcomes that you're striving for. And the ability to take the holistic brand promise, develop out the guidelines that represent your signature experience, and then subsequently to each of the sub brands within each of those divisions, so that they have their own identity. It's additive and inclusive of those signature guidelines, and then add on top of that the specifics of the channel. So if you're highly digital, if you're a face-to-face rep, like when we think about pharma, that is an additive consideration from an experience design standpoint. And we've done experience design, of course, in digital, but everything to our facilities design for bringing in customers, and how you work from a long-term perspective of a building that may stand 30 to 40 years without redesign, and ensure that we have an experience-centric evolution within the structure, the communications, and the technology that we use to represent the brand promise.
Yeah. Yeah, that's great. I'm realizing that all of you have different brands within your brand. So it's that's a challenge as well. And I think that's sort of similar to us managing maybe the customer experience across a franchise of brands and needing to integrate them or not. So I guess, can any of you tell us a little bit about how you maybe tactically or brought a program through to connect some of the two brands together or channels, and give us some experience there?
I could share that. So we are essentially moving legacy policies at MassMutual onto this new technology. And so there's two different contact centers, there's two different everything. But to the customer, it's seamless because they're going through one front door, and we are routing them to the correct area based on their policy number. And of course, people can always get to the wrong place. So we've worked with our sister contact center to work out a warm transfer process. Some people thought we should have separate numbers, and I was like, why are we going to bifurcate our experience and make our customers do more work?
Right. No, that's great to hear. That's exactly it, because that's really what you're trying to think about is what are they going to have to deal with when you're on the other end. How about any of you guys, Jennifer or Karen, with some of that combining issues or not? Like, are there times when you don't want them to be together, and how you've managed that?
Yeah, and I think specifically for our brick and mortar properties across the country, there's a lot of different sort of, like if you think about customer service part of the customer experience side, right, there's a different maybe style, but there's core tenets and things that are important. And a lot of it falls under, for us, we use our loyalty program and the different sort of tiers, and that you might be at Horseshoe in Tunica, Mississippi, and the style of service is going to be very different there, but you're going to be welcome with the same type of benefits and things that you are that when you walk into Caesar's Palace or one of our other properties across the country. So the style is different, but there are certain promises that we make along with, kind of under the umbrella of our loyalty program, so that what you're going to get. And then that's at least how we try to live, so that the experience is the same in terms of the benefits, even though, the actual kind of feel and flair might be different.
Yeah. So whether they're in that state or they go to New Jersey and they're in Atlantic City,
exactly,
it feels similar.
Yeah.
Yeah, that's great. Karen, I know Gore is probably Gore-Tex is the only brand part I know. So I think how have you done that in the past? Or
Yeah. So again, thinking back to that signature experience that encompasses all divisions, all brands, there are elements that have to connect back to that brand promise and reflect the fundamental of anybody in any division in any role should be able to execute in alignment with who we are. So such things as, making help simple, having deep empathy, demonstrate value, solve problems, and then each division goes through. We tried a unique approach to get there, though. We started with, what don't we want to be? What wouldn't we ever want to hear a customer say about us? And then you either solve that with what's the right pill, or what's the prevention that it never happens, which then generated down to some really clean statements about, how we want to approach those guides. And then the trick was to make them actionable and put them to the test. So pilot them out and make sure that they were something that everybody could do, no matter what their role was, no matter where they sat in the organization holistically, but it was something that they could connect with, felt that they had an impact to the customer, and that they were connecting to the promise of the brand.
Yeah. I mean, I think it's interesting because I think on varying levels, that's hearing the prior panel talk too about how the customer sales reps are really that face. And so that's really just like a customer service from a retail or from a where the customer and your consumer is coming in and trying to have that consistency across brands and across, for us, it would be across our company's experience. And I think that's always a challenge. I think too, one of the things that is consistent challenging is the data integration. And I think, can you guys speak to a little bit about how you've managed through data integration, if there's been projects you've worked on where that's been solved, or what approaches you used for that in order to make that seamless connection or make that look more seamless for the consumer?
I guess I'll go first again. We'll just keep going in that cadence. Well, with this new digital platform, as part of the process, usually when you get life insurance, you have to go to the doctor, you have to get your medical records and all of that. So with the individual permission, we actually use data feeds from electronic medical records and pharmacies, pharmaceutical data, to do the underwriting on the policies.
Oh, wow. So you're managing consent underlying all of that as well. So that's
right. Yeah, we're not just doing it. You have to give us your consent.
Yeah.
But that's a way to what we call do fluidless, where you don't have to get blood draws and things like that. So I think that's a pretty cool way to buy life insurance, and the whole premise of the company was to sell life insurance to millennials. And
Make it easy. Yeah,
yeah.
absolutely. And on your phone. Like, I feel like now that everything can be done on the phone. So it just keeps it simple. That's great.
Your turn, Jennifer.
Yeah. So I'm trying to think. I don't know that I have a perfect solution, but I can just give you a real life experience that we're working through. So, when we integrate, whether, through a sale or transition or merger acquisition, different properties, we have a pretty good process to convert those properties onto our loyalty platform and, switch everyone's accounts over again so that we can translate the customers' like past behavior and their sort of worth with us and make sure that they fall right into the loyalty program. But we have some struggles with online and trying to integrate that experiences. So, we've worked with a couple of different products and different providers in states, and between Pennsylvania and New Jersey, it's a very important undertaking we're working on right now, where when you play with us online, for it not only to have you be earning points towards, your status that is with our loyalty card, but also that once you sort of log in, that it recognizes your status, it recognizes sort of what shows you the type of slots that you like to play when you're online. When you're in the brick and mortar and all of that. So we're working on that now. I think we could get a lot better, but we're trying to figure out ways that, again, as soon as you sort of log in, then we know what you like, what your history is, and that translates not just to online, but also when you interact with us in our brick and mortar properties.
Yeah, I would say that's a big challenge.
Yeah, it's a very big challenge, but it's important. So
yeah, definitely. I think.
And I'm going to build on that if I can to not just brick and mortar, but to the salesperson, because I think that's really relevant to pharma. And we think about the data integration and omni-channel, and it's really critical for all of us from that inside out perspective to have as much view as possible, and using platforms like salesforce.com and all of the capabilities that come with it is great. But we have to take that step back to reverse it from outside in and think about not only getting the customers the information that they need, but making sure that your touch points, like your sales folks, have visibility to what they're exposed to what they're engaging with, reading, questioning. Where do they go to get their information? What communities are they engaging with, and how frequent and active are they? That ability that the front line, if you will, that has the primary engagement with the customer has the strongest visibility to that data as well. That integration there is critical for them to be well armed, well prepared for the conversations and how to continue that progression in the relationship. Not having visibility and having it all kept inside is not going to serve well.
Yeah, and I think some of you guys have had that experience with healthcare or pharma too. Is there any advice you can give to the pharma companies about how to do it better? I guess you've seen it in both pharma and outside of, or comparing it to like what you're dealing with Caesars. How can pharma do that or improve what our experiences are with our customers, patients, and HCPs?
It's funny, I actually had to call a pharmaceutical company this week for a drug that is not covered by my insurance, and they offer a discount card, which I've had for a while, and all of a sudden it stopped working. And I got disconnected. I had to call back. I had to retell my story. Just having a good customer experience when you have to interact with, that's a special division, and it's a consumer line. So
right.
They didn't have, they didn't call me back. They should have called me back. They had all my information. So yeah. I think it talks to what Karen said, they know, if you know your customer, you know who they are, you get disconnected, you call them back. Kind of thing. So
just common courtesy things.
back to basics. Yes. And it happens.
What makes a good customer experience. Yeah,
right.
Exactly. That's funny.
Yeah. I would say
has any tips for pharma?
Yeah. I guess, pharma, or just in general, I think to be successful, right, is to listen, like listen to the customer, to the end consumer, listen however you can, directly or indirectly through data and analytics and whatever information, and, you know, sort of be curious about finding different ways to find the information to listen to what the customer wants or is experiencing with your product, so that you can get better. I mean, we are constantly, I know, sort of, it's been teed up before about how much information we have on our guests, which is true, right? We have a lot of information, especially if they're, again, playing with their loyalty card, but we're always looking for other places to find information through, you know, how people actually physically move through our properties with, you know, geo location services. We have, you know, chat bots that are there to sort of help when our customer service agents aren't available. And we looked at like listening through that. What do people ask for? Where are the breakdowns? What are people are looking for? And so, you know, then we can sort of find different ways to address it. There's a lot of places you can listen and then figure out how to, you know, sort of adapt your CX to match what the customer wants.
Yeah, that's a great point too. And I chuckle when you say chatbots because I know Seth just loves them, but I think they have a long way to go and I think they have a lot of opportunity. So to your point, if you're listening to what's being asked, then you kind of get a lot of information, a lot of insight. So that's
it helps us with, you know, hours of operation of things, or hey, look, people are looking for late night sushi and it's not an option. Right. Maybe we should consider this, you know, things like that.
Right, exactly. Yeah. It could range from anything. So.
Yes, exactly.
Mm-hmm. I would add just to what I'd say is stack the maps, right? Stack your stakeholder journey maps. Look for the inflection points where they all connect or where multiples connect. And if you know, I loved what you said about listening. It's also asking the question from all the degrees around that, right? So what does the HCP, the provider see? What does the salesperson see, right? So when you stack the map of everybody involved, then you have those interaction points and you just want to look and start to ask some questions. Absolutely the listening, but then ask where does the next map interact and what are they bringing? What do they have purview of? And what should they know? And how can we take that experience of where they are in the journey and bring some you know, love points to that or some improvements to that? There's amazing layers when you stack those journey maps that you get insights to how can we help. Sometimes it's helping your field sales associate with that one more piece of visibility. Sometimes it's helping, you know, provide pass-through from the provider to the patient, that one more piece of education or one more contact point. So it's just a different type of perspective that gives you a little bit of a strategic approach when you see them all lined up.
Yeah, that's great. And that's true. I was thinking, as you're saying, I like that stack the map because it really is, it's knowing that everybody has a different experience and a different perspective, how they're interacting with the company or the brand. And so really trying to take that look from the outside in at all angles really will help that, the understanding and then helping you build a better product at the end, which is the experience. That's good. Yeah. This is great. I was just thinking, one question I had too for you, Jennifer, is without the loyalty program, how do you guys manage customer experience? Because I think that's something that Pharma struggles with a little bit. We don't have direct contact all the time, or not every brand has a loyalty program. So how would that work too?
Yeah, I mean, I think that's, you know, at the basis of customer journey, right? Obviously, everyone starts as an unknown sort of customer to us and then trying to get them through the funnel into the ultimate spot where they're a part of our journey. But the beginning part is important. I mean, we rely a lot on technology and, you know, especially when the transition of so many more people are booking their trips and their hotel stays online and looking for the best rates and different things like that. So we spend a lot of time thinking about the customer journey when it starts, people just sort of like looking to plan their trip overall, right? And that customer at that point is completely unknown to us and we don't know what their sort of future value could be. You know, they could be a super VVIP or, you know, so we try to work through that process to consider it even at the beginning. Again, I know we differentiate sort of service and amenities for customers as you move up through our loyalty program, but at the beginning, everyone should be treated as if you could be that sort of very top tier. Yeah. So that's the goal. It's hard to sometimes execute, but yeah, we should, you know, treat everyone in that way as what their, you know, sort of future value could be.
Yeah, that's a good point. I mean, it kind of even thinking about Eileen talking about the white space docs and really feeling that they've got a little bit of attention once they've, been approached with a channel that we don't normally use. So that's good. And so, yeah, just always the potential of the customer could be anything, and that's good to keep in mind. And I think with MassMutual, probably the same idea, right? Because you're trying to garner new customers all the time, right? So are you reaching them out in the media world, I would assume, right?
And not to bore you guys but most people buy a term policy and then they want to convert it, to a life policy. So you have to make that process easier and notify them of, when that possibility comes up. So,
yeah, I would just say, Vicki, you might get a lot of people checking online, because I know I'm not a millennial, but I like that we're trying to make things easy for everyone. So no matter how old I get, I will always want that. So,
yeah.
hey, mobile phone experience, that's easy. That's way, way better. So that's good. Well, this is good, you guys. I think we don't have any questions online that I could see. So I think I'm going to thank you guys very much for your time today and hopping in and giving us your perspectives. It was very good to hear what's going on in the other world of other types of customers and how we can bring that to pharma. That's great.
Well, there was one in the chat.
Oh, which one?
But that was from you. That was from you.
That was for me, and I was just wondering if you feel that, that the pharmaceutical company can treat you like that because they know that you're dependent on the medication. And so, if you want a discount, you got to put up with our shitty customer service. No. I mean, we're not going to name the company, obviously, but I mean, there are situations where if they know you're a customer, you're not going anywhere. So.
Well, she doesn't necessarily have to be, because she had the card that stopped working. So you know what? Go back to your doctor and find something else. So, it's never a guarantee that you have the customer, no matter what.
And then I was just thinking about this, and life insurance itself is a form of gambling, right? So there should be similarities between what Jennifer is doing and what you guys are doing on at least, trying to.
It's all about risk.
Change the odds and make sure that that the house, always wins in that respect. So it was kind of cool. And Karen, I'm sorry, I didn't.
It's a whole new meaning.
You might have mentioned this earlier, but at BI, what area will you be working with? Is there a particular therapeutic area or sort of
not
general?
Across the board? I'll be I'm the director of experience strategy. So holistically lifting up that capability across brands.
Okay, I wasn't sure if there was a specific area that you were going to be working in and moving forward from there.
Yeah.
And then Vicki, right over your left shoulder, I saw a little creature. Who had joined us, or is it?
I have 3 dogs, so they constantly in my office. But that's River, our golden retriever. So.
Yeah, I saw the legs.
Yeah. Oh, they're gonna start barking now.
Well, it's nice that you keep the door open and they don't fuss you. So, most people have them, jumping all over them during their video presentations. So I just wanted to chime in there with a couple questions. We can close it up, and we're going to get ready for our next speaker, which is Kristen Berman. And so thank you, Jennifer. Thank you, Karen. Thank you, Vicki. And thank you, Kristen.
Thank you, guys. Thanks.
Excellent look at customer experience outside of the world that we live in every day. So thank you very much. You can just